Coming to the topic, and I've spoken about this topic about conferences as Dr. Srinivas sir was mentioning, and these travel grants and the exposure that you get in these conferences has been so enormous for me. I got to meet so much, and Lalit sir and people like him, I have not known them personally, I have not worked under them, but meeting them through conferences and meetings has been a great mentorship experience for me. So you get to talk to them, interact with them. So that is the one of the biggest takeaways from these meetings. And another thing that for all the youngsters, I would like to say that take your meetings, your conferences, don't attend too many of them, but whichever ones you attend, mark them out for that calendar year and take them really seriously. So during my training period, I tried and attend a lot of international meetings as well, but I separated work and pleasure. So the 4 days of the meeting was very serious for me, and the abstract book and all the sessions that were going on were properly marked, and I tried to attend all of them. And the traveling and the tourism aspect came later. So you should really take those seriously, and you will get a lot of impact, a lot of value to your career professionally from them. Thank you, the whole organizing team and IRSI and Youthful part of IRSI for giving me this opportunity. I'll be talking very briefly on the retina practice aspect. The topic that was given to me was the difference between the full-time practice and freelance, but I'll try to cover briefly all the aspects of retina practice. And I hope that all the panelists, all the seniors that are present here are from different aspects of practices. So I really hope that we can have some inputs from them and they can really guide people like me and all the other juniors how to proceed in their careers. So what after fellowship? There are a lot of options for a retina surgeon these days. Of course, a charitable government or a tertiary institute, the big institutes, you can join one of them. You can join a corporate practice, a private or a group practice, and of course, freelancing. So I'll take each of them really briefly so that we can have time more for the discussion on that. I'll talk about just pros and cons of these practices. So a big institute gives you the opportunity of a high volume of patients, and of course, some of these institutes give access to the latest technology that is there in the market these days. This in totality helps you in advancing your career, and a lot of us after the fellowship realize that there are certain lacunae in our training, and probably we are not ready for a full-time practice or an independent practice. So this gives you that opportunity, and you can find some great mentors there who can guide you in your careers. And as Srinivas sir was talking about research and publications, so these institutes give you that opportunity. And of course, if you're passionate about teaching, that also comes in here. And no investment from your side. The negative points being that the salary can be a little on the conservative side. There's a certain hierarchy in the institutes which you need to follow. You are not the boss here. You are seniors whom you report to. So things won't happen always the way you want them to happen. And there are rules and regulations of the hospital that you have to stick to. Coming to the second, that is the corporate practice. A lot of corporates are coming in, and they're opening even in the smaller cities these days. So it's a very good opportunity for young retina surgeons. A big plus is the salary. You start at a very decent salary. You get access to premium patients, and some high quality patients are there, and you get the confidence as sir was talking about when you, Lalit sir was saying, when you operate on a very VIP patient. So you have the access here. Most of these hospitals have good infrastructure and equipment that they provide you, and you acquire some soft skills, management skills, and how to the commercial aspect of things are also comes in there. And again, no investment from your side. The negative aspects being that it is a skill and a revenue-driven model. Almost the standard of training in India is pretty good compared to other countries, but some of us might not be that well trained and find it really difficult to survive in a corporate setup. And again, during our training, we are not exposed to the revenue aspect of the business aspect of the practice. So that can be a cultural shock kind of thing where people are talking about money and revenue and the number of surgeries and patients. So that can be a bit difficult for some. There is practically very less or no job security. Most of the corporate practices have a retainership kind of a model where practically you can be chucked out on a day's notice. So that is always there. Being on a retainership model, but still it requires full-time commitment, and most of these hospitals don't allow you to get attached with other hospitals. And a lot of these hospitals have multiple centers. I need to, I'm part of a corporate hospital, I need to look after around 7 to 8 centers. So it might involve a lot of traveling. Coming to private practice, a lot of us want to start this and jump into this. Of course, you are the boss here. You are the brand. People are coming for you. You get to decide how things run here, and might be financially better in the long run. So it's like a startup. If it's successful, you are the boss. You are the winner here. But of course, certain negative. A lot of heavy investment, especially a retina practice, will incur a lot of cost, and maintaining these equipment is really costly. It's a 24/7 commitment from your side, at least initially. A lot of accreditation and norms that you need to follow these days. And what people are doing these days are they're moving away from the big cities because of the super saturated cities and the high cost of land and all these things. It becomes difficult to set up a practice here. Now, another thing that is coming up is the group practice. A lot of people are going for that. It has basically all the pros of a private practice with lesser liability and all the cons of a private practice. But it's really difficult to find these like-minded people whom you can work with. Last but not the least, of a freelance practice, practically very less investment here as well, and might be the only way in metro cities. So in cities like Mumbai and other cities, people have, this is the only option for them if they want to stick to the city. And you don't need to really worry much about the patient load because the hospital takes care of that. The negative aspect of it being probably you are not the brand here. People might not come for you. You are just the pardewala doctor or the retina surgeon of that hospital, and people don't recognize you that well. Involves a lot of traveling, of course, and since you're traveling and you're always moving, follow-up of the patient is difficult. So if there's a complication the next day, you might not be there to cater to the patient. Of course, again, there is no job security. If the hospital you're attached to, wants somebody else, or their children come into practice, then of course you lose the job. So coming to how to find these jobs, as Srinivas sir had talked about VRSI, there are other job portals like YOSI has also a job portal, and AIOS has a very old job portal. They have been putting jobs from a very long time there. So you can access these sites. And the Young Ophthalmologist Society of India has a help desk as well, where you can mail us on the official email ID and we can help you in finding these jobs.
What in your experience is the way forward? Because you got out of fellowship, then of course we know that now you're in a corporate hospital. Was there anything in the middle that you did?
No, I felt confident at the end of my training, and I'm probably right. And I joined a corporate hospital straight out of my training. I was pretty comfortable with that, and I'm visiting certain other centers also. So I have this experience of a freelancing model as well. But it is really difficult for me as of now to say what would be the right way to go. I think it's a very individualistic approach and depends a lot on the geographic location as well. But I would really love to have inputs from all the seniors here, because that would really give us an insight.
Dr. Srinivas sir, your thoughts?
Excellent talk, Diva. I think you have just spilled the beans, and what the freelancer or the person who doesn't have the backup or who doesn't want to join the institution, you have just told that very diligently. I agree with most of the points which Dr. Diva has said it. If you want to do a freelance practice, definitely it's a good job, and it has to be in a bigger cities. Smaller cities, if you are going to do, you should not touch cataracts at all. The moment you touch the cataracts or start doing anything, the referrals immediately stop there. And I have seen, because I go to Goa to operate there, and I see a couple of freelancers coming in and trying to say, sir, would you like to do? Because see, nowadays ViteroRetina has become slightly expensive. Now, if you want the best of the setup, then it goes into either the Constellation or many other, which might be difficult for the initial people to invest. But I'm sure it's just a time. You can start with the Reticare machines or any of these kind of machines, which are equally good, the Indian brand machines. Try to take less complicated cases in the beginning. Once you gain the confidence of the people around, once they start referring you the cases, once they get to know that the referral doctors, okay, he's a good surgeon, I had sent a patient, he has done really good. That is when you jump into doing for complex cases. Immediately, once we go in, one patient can definitely not try to bring a bad name to the doctor, because he's a single-handed and he's not under the shadow of the institution. If you are under the institution shadow, the institution takes the whole blame. But if you are a private practitioner, a freelancer, then definitely it's always better to take up and have a good rapport along with the people who are around. Try to go and meet them. Try to tell, sir, I've started my practice. I would like, even though they like you or they don't like you, just try to go and meet up. Try to gain confidence. Try to take up their confidence, sir. I'm always there. Any help you need, please let me know. The kind of humbleness we people show when we are doing a freelancing, that is when we win their hearts. And that is when we start getting more and more referral practices. For the institutions, I don't think anything to be said, because most of the things are run by the institution itself, and the rest is left to. Lal sir is smiling. I don't know what point. Yes, sir. Go ahead, sir, please.
No, I am in absolutely opposite of what Srinivas said. Freelancing should be discouraged. I don't, after having so much of this thing, never do freelancing. The reason is you are exploited at it. You see, Himanshu, even though he had retina training, but now he is a great cataract surgeon. Amar, retina trained, he is a great cataract surgeon. Abhay Vasavada, cataract, retina trained. So my thing, after having spent nearly 3.5 decades into retina practice now, freelancing, I would discourage. It's a sheer wastage of time, and it's exploitation by all these big people. So they call you, and you never develop anything of your own at all. If you have the confidence, you see, therefore, I always tell all these people who are budding, do you have the skill set or not? If you have the skill set to deliver, like you can confidently, make the ports, do a vitrectomy, mobilize the retina, settle the retina. If you have this skill set, please do not do freelancing. Freelancing, usse better to ye hoga ki, you open up a small, even though you may have to take a loan, then you should, because skill set is important, very, very important. So you see, travel, they will make you travel from here to there, from Chandni Chowk to Karol Bagh to wahan chale jao, wahan ek case hai, aaj wahan ek case hai, wahan ek case hai. You keep running around. By the time you realize you're already into mid-40s. You see, by the time you finish your CNC, you are into early 30s. And 1 decade you may waste. So therefore, that is not my cup of tea for anybody to do freelancing. What I would advise instead is, after you have done a fellowship, because never jump into any kind of practice after doing a post-graduation. Even though you may be Einstein or genius, immediately after MD, you are not prepared for a VR practice. So 3 years of fellowship, or what we call CNC, is a must. Travel, even at your own cost. Paisa nahi milta hai, koi baat nahi. But aim should be to develop a skill set, and first couple of years spend in a charitable setup or a government setup where high volume, take advantage of the high volume, because high volume will give you confidence. And once you develop confidence, then you can dictate all the Amars and Mahipals and Vasavadas and all these people. If you don't, then they will exploit you reverse. You can record this, no issue.
Dr. Mehta, your thoughts?
What Dr. Lalit said is, either you ride the horse or the horse rides you. That's the story of life. If you want to lay the rules of the game, don't get exploited, no question about it. Right. And the world is there to exploit. If you allow yourself to be exploited, there is no reason why somebody will not exploit you. Every possible reason, your body language. And what happens is, when you just finish fellowship, you're still not confident. You don't have enough bloody money to take a car, also have anything. You don't know whether you'll be able to sustain your family. You're still struggling, and you're not even sure whether you'll be able to handle most cases, because as Dr. Lalit says, skill set. When will you cut off the cord and you know that you'll be able to handle the case on your own? That is where he said, consistently have huge volume. Something said very important. Go in a high volume practice. So middle of night also, aankh band karke, jitko nahi karna hai, jisko chutti lena hai, let them enjoy. You do all the complicated cases. If they want to go party, they want to do whatever, you have the pleasure of doing as much work as you can. And we are all finally mechanical people. Surgeons are mechanics. So subset, spinal level, we are going to be operating. So more number of cases that you've done, it is cataract, it is phaco, it is whatever that you saw. And as he said, he hit the nail. Don't let yourself to be exploited. Do maximum number of cases, cut the cord, start your practice, get your confidence. And there is enough place for everybody. Don't get overwhelmed that it is full. There is enough place for everyone. Nobody goes hungry. Get that confidence back in your mind. Whichever way you start, the dots will settle up later in life. But start, push yourself, get on going. That's it.
Dr. Saurabh, sir, your thoughts?
Sorry, you have yes, after.
I think I agree with what has been said, that especially in a smaller city, what Srinivas said, that you should try not to touch the cataracts, because that is not a very good thing to do. And at the same time, I would say case selection is very important, especially in a retina practice. You should go for good prognosis cases initially, especially in a smaller private practice, because that helps build up your practice. And also giving feedback to the referring surgeon. Nowadays, even on WhatsApp, you can just maybe just click a picture of the report or whatever you found, or you've done an OCT. So that gives a lot of confidence to the referring surgeon to send patients to you, because he's updated about what happened to his patient. He's very keen to know what happened to what was the outcome for the patient. So I think all these are very valid points that people have discussed.
Sir, just one point I want to make, Pooja, in 30 seconds. Sir, I partially agree with your point about the exploitations being done to the freelancing system. But what here I say is, for the people who doesn't have a backup, who doesn't want to join the institution, they can join the freelancing initially. But I make sure that wherever you do the freelancing, you have to put up a board that the ViteroRetinal services is provided by this person. You should not become a shadow surgeon. That I always go against it. You should not tell that, okay, I am doing.
But how many of these, people will allow you to do this with shadow?
Yeah, that's what I'm telling, sir. If they allow you to
They
do
will
it,
not. All
then
these
do it.
people
But
don't allow.
never be a, yes, sir, I agree with your point, but never be a shadow surgeon.
Right.
Like telling that they are doing and you are going inside the OT and trying to do that. That never has to be done. That if you want to do it at a board. I always tell them, if you want my practice, put up a board that it is being done by so and so institution, so that let that institution go and cater that. And by that, at least some patients, he'll build some clientele. That's what I was just trying to. But points well taken, sir. In nowadays, in certain situations, especially in big cities, they are being exploited. I agree.
In the initial 5 years of your, after you finish, do not pay any attention to money at all. So don't think that you have to earn. Believe me, that first 5 years of your, after you finish your residency, after you have acquired your skill set, you're confident. So keep doing. Whether anybody pays you or not, I don't care. But after you have, settled so many retinas and done so much, of all the surgeries, then you can. You see, because inner confidence has to be your, that comes from within you, that I can do it. And then I think you can dictate by, this is what I want. And if you have, if your father is, or one of your relatives has already practiced, then sky is the limit. If not, the issue comes there. Whether what Divakant was saying, that a solo practitioner has to have a heavy investment, this does not matter. You see, all of us, in fact, all of the younger people listening, should always begin a small investment if they can. A 2-bedroom house in a commercial area, similar to 1,000 square feet, should be taken, whether you know the job or not, because that will be your ultimate, savior. Suppose you don't get a job, suppose you are tucked out, suppose you are whatever. First investment, don't do on your house, do in a small, around 800 to 1,000 square feet area. That should be your first investment in life, because that gives you confidence that कहीं भी कुछ नहीं हुआ तो मैं यहाँ बैठ के कुछ ना कुछ करूँगा. That should be your first investment. And then I think 5-6 years, keep developing your confidence that alone also you can operate without the help of your mentors or trained sisters. Because you see, in RP Center, we are all spoiled. Sisters are so well trained that they can, train a VR surgeon also. You should learn to operate without the help of all these things. And as Srinivas said, even if you may not have constellation, learn on Appasamy or Reticare or this, because that gives you a lot of confidence that any machine anywhere, because it is the man behind the machine more important. All our youngsters, they want to just enter, make port and do cut and come. It should not. You see, my fellows who come, so first 3 months I will tell them, pehle beta machine ko aap dekho. Keep every part of the machine which you know, which I have forgotten in fact, but where to put this, and then learn to lay out the trolley, then learn to sit on the side piece for 1 month or so. Then I will make you sit on the main.
So that was an extremely valuable teaching. We will definitely keep these points in mind in the future.
They're just suggestions. You see, all Divakant and all they and even Rohan, they now are big people. They can easily guide us also. But it's a mutual learning. Believe me, it's a mutual learning depending on a couple of factors: your financial situation, whether your pop is a doctor or not, whether he has a clinic or not. These 3 factors will determine what he will do. Like Rohan is blessed. He can open practice anywhere. He can buy 3 consultations today.
So reminds you of the book Rich Dad Poor Dad.
Yes.
Yeah, that's what Dr. Lalit Verma is talking about. Invest in your business.
I am being very straight and honest. I do not, mince here and there.
Yes, absolutely brilliant point of view. Rich Dad Poor Dad. I did that. That's the name of a book which most people should learn in investing. That invest in your business. Don't buy a car. Buy a machine. The machine will buy you 10 cars. You don't have to have a Ferrari, but your femto can get you a Ferrari possibly somewhere.
So in Hindi, a lot of our oldies used to tell us, "Dukaan se makaan banta, makaan se dukaan nahi banta." Therefore, I said, please invest in a small place.